Assalamu alaikum. This is Dr. Tariq Adab. I'm from Chicago, from USA. I'm originally Syrian, born and raised and trained, and came to US. I did my fellowship in cardiology. I came here under the umbrella of Syrian American Medical Association to help the Syrian cause in Lebanon. As you know, we have a tremendous problem in Lebanon because of much higher volume of patients, refugees came from Syria that are reported and not reported. And it came to my attention that we do have major shortage in cardiology service in this area. So I came with my father-in-law, Dr. Talal Samboli. He's a GI and I'm a cardiologist, and I had a very good, successful first 2 days at Mashfa or Hospital of Al-Biqa in Lebanon, which is a very gorgeous, beautiful area in the mountains. We did about 15 cases of coronary stenting, multiple stenting, and we did one peripheral angiogram. Was very successful, and we had very good results without any complications. We had a problem with getting supplies of stents, and we had difficulty paying the prices for the stents for the hospital. Although I have to be very honest, the hospital was very accommodating and the doctors were very accommodating. And I met with the owner of the hospital and also the medical director, and they showed appreciation to our effort and full willingness to cooperate with us the best they can and help us, getting those procedures done the way they can afford. However, we have a tremendous challenge with getting the stents, and we appreciate if we get more emphasis or help from the SAM and the frequent following visits to provide stents. We're trying to get more legitimate documentation of our service here. I noticed we have state-of-the-art 3 medical centers covering all aspects of healthcare, from cardiology to all kinds of specialties, and women care and cancer and physical therapy. And they did a tremendous great job, and I'm very impressed actually. They have state-of-the-art equipment. They could afford getting it on board. We just have to try to give them the things that they cannot, especially the financial aid as well as stents. And also we have to do a good job in helping in primary and secondary prevention in cutting down on the smoking, to cut down on the prevalence of the smoking as well as the diabetes. Today we had a clinic day, which is my 3rd day here, and we saw about 7 patients, 6 of which were coronary artery disease and diabetes patients. And unfortunately, I noticed 5 of them need actually coronary angiogram, but we cannot at this moment just because we have limitation in the funds available. So hopefully, inshallah, I put them off for 3 months. We focus on optimization of their medical therapy, and hopefully, inshallah, in 3 months we'll try to get them coronary angiograms. By that time, hopefully, we'll get the stents done and more funds. And we'll try to also focus on the implementation of the cardiac medical therapy, the optimal therapy and the guidelines, and try to spread it around in the medical personnel here. Inshallah, also we'll try our best to have them get independence in getting the imaging modalities in cardiology and echocardiography as well as vascular and venous ultrasounds. We should do more screening for also aortic aneurysms, since a lot of patients have diabetes and hypertension as well, and sudden death in the families. So inshallah, we'll have 3 more days, and we'll see what we can do. Thank you very much.